Good morning, everybody. My name is Mehrgol, and I'd like to welcome you to our panel this morning. Our panel is called Effective Applications of Psychological Science, Drawing Parallels Between COVID-19 and Climate Change. And before we get into the discussion today, I would just like to welcome and introduce our wonderful lineup of panelists. So first we have Dr. Angel Colón Rivera, who is a senior policy advisor to U.S. Senator Robert Menendez in the United States Senate. We also have Maya Godbole, who is a Ph.D. candidate in the City University of New York. She is also a graduate intern in the SPSSI United Nations team, which I'll get into a little bit more. Many of our panelists are involved with that team. Dr. David Livert is the main representative to the SPSSI UN team. He is also an associate professor of psychology at Pennsylvania State University. We also have UN SPSSI representative Dr. Laurel Peterson, who is an associate professor of psychology at Bryn College. And we have SPSSI UN graduate intern Priyadharshany Sandanapitchai, who is also a research associate at Rutgers University. And last but not least, we have SPSSI UN representative Dr. Peter Walker. And I would also like to give a special thanks and shout out to the folks who are not on the screen right now, but who were really instrumental in putting this presentation and the report that we're going to talk about, bringing it all together. So that's the co-writers of our report listed on the screen, the entire SPSSI UN team, and our wonderful CSPC volunteer coordinator. Let me just introduce myself. My name is Mehrgol, as I said. I am also a graduate intern of the SPSSI UN team. I am a PhD candidate at McGill University, and I will begin by kind of setting the universe for what we're going to talk about today. So the first thing we want to think about is, why are we talking about COVID-19 and climate change together? Why should we consider these two global crises hand in hand? Well, as we've all kind of lived through it, the COVID-19 pandemic has caused unprecedented impacts in public health, healthcare, and the economy, as well as restrictions of normal social interactions across the globe. Through this crisis, the climate crisis persists and has been called a deeper emergency by the United Nations Secretary General. In many ways, these crises are linked. Both are propelled by human action and human inaction. They have both sparked political divisiveness across the globe, and they pose threats to fundamental human rights. So, for example, the United Nations has identified 17 human rights-oriented global goals for sustainable development, also referred to as the SDGs. One of these involves climate action, and since the start of the coronavirus pandemic, the United Nations has integrated COVID-19 implications in all of these sustainable development goals, including the one for climate action. And that's the graphic you see on the bottom left corner of your screen. So this is showing you that while COVID-19 may result in a 6% drop in greenhouse gas emissions for 2020 as a result of decreased human activity, we are still short of the 7.6 annual reduction required to limit global warming to only 1.5 degrees Celsius. So you can see the link directly there as reported through the United Nations. And indeed, some folks, such as one of the co-creators of the United States Green New Deal and the United Nations Secretary General, have indicated that the COVID-19 crisis has actually opened the doors for talking about climate change in a concrete way, and for identifying systemic shifts for greener and more sustainable global economies. Now, the next natural question is, what role does psychology play in this? How does a psychological perspective pertain to public health and environmental science? Well, you might not know this, but psychological research has a long-standing tradition of engaging with human rights, including through the Society for the Psychological Study of Social Issues, SPSSI, and their NGO to the United Nations. This is the team that most of our panelists today engage with. So within the United Nations, SPSSI has advocated for the inclusion of mental health in Sustainable Development Goal number 3, good health, for example. And indeed, psychological research pertains to all 17 of the Sustainable Development Goals. Now, psychology provides a holistic lens to probe human behavior at multiple levels. So within an individual, within groups, and across all of society. And it brings a lens to talking about how behavior can impact, changes in behavior can impact climate change or promote good public health. And recognizing the essential role of human behavior change to facing both COVID-19 and climate change highlights the critical role that psychology can play in shaping how individuals, communities, and nations can respond to these crises. And so in this regard, collaborative, cross-disciplinary approaches in responding to COVID-19 and climate change must be encouraged, including the consideration of psychological science. Now, to guide today's discussion, I will be presenting a framework called the Social Ecological Framework that will give you an overview of all the different talks in today's panel. So a social ecological framework is a general approach, and it's the idea that people are embedded in multiple layers of context. This type of framework has been applied separately to the study of climate change and how individuals impact global climate, as well as how communities and society impacts global climate. And it has also been applied to a discussion of public health. And so here we're going to fuse those two approaches, and we're going to use this framework to guide our discussion of the intersection of these two global crises from a psychological perspective. So we will start at the community level. Dr. Peter Walker will speak with us about community resilience, and Maya Godbole will then speak to us about vulnerable groups. From there, we will look at relationships between individuals within and across different groups and communities, and that discussion will be led by Dr. David Livert. And then from there, we're going to move on to the intrapsychic, looking within an individual's mind. So first, we'll go to mental health with Priyadharshany Sandanapitchai, and lastly, cognition with Dr. Laurel Peterson. And from there, we'll zoom out a little bit, take a bird's eye view, and think about applications to policy by speaking at a society level and hearing from Dr. Angel Colón Rivera. And so to help with the discussion today, I'd like to invite you to reflect to yourself. What are the ways in which we can draw parallels between the COVID-19 pandemic and global climate change? You can feel free to bring these up throughout the panel today. And so the structure of today is going to be the presentations from our SPSSI UN team on this foundational report that we are working on, then the policy perspective from Dr. Angel Colón Rivera, and throughout all of this, we encourage you to submit your questions through the Q&A button in the menu. And then at the end, I will be synthesizing your questions and presenting them to the panelists. And I'd just like to remind you before we start, if you're interested in the report we're talking about today, or if you'd like to learn more about SPSSI, I encourage you to reach out to Dr. Livert. This is his email. He's the main representative for our team. You can also visit the SPSSI website, or you can drop your own email address into the Q&A or get it to me somehow, and I will follow up with you afterwards. So without further ado, I would like to introduce our first speaker, Dr. Peter Walker, to tell us a little bit about community resilience.
Important steps in curbing both COVID-19 and climate change. One of the thoughtful discussions of climate resilience and documentation of how to attain the face of this in the face of threat is the ICP Working Group 2 fifth report. The International Government Panel on Climate Change, IPCC, provides an international accepted authority on climate change. Each assessment report produces the 3 parts, each with its own working group. The IPCC does not carry out its own original research. Instead, it bases its assessment on published literature, which includes peer review and non-peer review sources. Next, please. Key takeaways from the IPCC report. awareness, high level of awareness of the risk, institutional change to affect resource management, leadership that affects response to complex challenges. One of the remarkable people in the States do emulate some of this is Governor Cuomo of the state of New York. Resources, access to scientific technology expertise, and information linkage in order to learn from others. In practice, continuing a development and evaluation of vulnerable assessments and risk management, development and reference based on emerging information and expertise, and policy, regulatory, and legal frameworks that support and distribute to voluntary action. Next, please. Why are community groups essential? Although community groups may vary in size and focus, they share these key attributes. They're equipped with local knowledge, they're within local networks of stakeholders, they express local values. Next, please. How can communities support local resilience? They can identify community strengths, become aware of diverse needs, emphasize benefits, use history, find individuals who can identify common ground, learn from each other. Next, please. In 2019, the American Psychological Association reaffirms its 2011 policy resolution and commits itself to continued action to address global climate change on the basis of scientific evidence, applied and clinical psychology expertise. Further, APA adopts an interdisciplinary and interprofessional approach to addressing climate change, including collaborative action with other scientific, professional, policy, and community organizations in the United States and internationally. In 2019, 40 psychology organizations, including the American Psychological Association and the Canadian Psychological Association, resolve that our organizations will advocate for and support international, cross-disciplinary, collaborative action to mitigate and facilitate adaptation to climate change. Next, please. Next follows a summary of 2 or 3 common outcomes from climate change issues, and I ask you to draw in your own mind the parallel between that and COVID-19. Climate change and the impact on community health, loss of community sense of belonging, increase in violence and aggression, increase in social instability. Next, please. Impacts on, although this slide addresses an extreme weather event, I ask you to imagine the parallel between the slide and the onset of COVID-19. Trauma and shock, loss of loved ones, loss of livelihood, terror, anger. Strains on social relationship, children may have to attend no school, loss of secure environments, and severe reactions, major depressive disorder. Next, please. The impact of slow onset events like sea level rise. Pictured here is Jakarta, Indonesia, faced with not only sea level rise, but a sinking city. A sense of loss, helplessness, and resignation, and a sense of loss of control. These are all issues that may occur with slow onset emotional issues. In conclusion, what do? Engage the public, give the public confidence to cope and act positively, communicate specific solutions, specific action ideas, highlight co-benefits, be careful with imagery, and emphasize the power of collective action. To strengthen communities, strengthen the social network, develop patterns of working together, create occasions that bring people together, inform and involve the community, develop trust and action focused on warning systems, and pay special attention to vulnerable populations, which is the subject of our next panelist. Thank you very much.
Thank you very much, Dr. Walker. And now I'd like to invite Maya Godbole to speak more about the role of vulnerable groups.
Thank you, Mehrgol. So both COVID-19 and the climate crisis disproportionately affect certain groups that are already disadvantaged and vulnerable in our society. Not only does this stall and disrupt human rights progress, but it exacerbates already existing inequalities and inequities in our society. We know that certain groups are disproportionately affected by these events, but research also shows that there are important group differences in how people cope with and engage with these crises, as well as the extent to which they're involved in leadership and decision-making around these events, and more broadly. This underscores the need for a human rights approach when discussing, analyzing, and mitigating the effect of these disasters. Specifically, it's important for policy leaders to adopt this group-based lens, and in doing so, we'll be able to acknowledge and bring awareness to the links between climate change, COVID-19, and social injustices. Next, please. Disparities in outcomes for members of socially advantaged versus disadvantaged groups have been widely demonstrated across cultures. And we know that this can be cumulative over one's lifetime, affecting outcomes through the entire lifespan. And in fact, early advantage or disadvantage is critical to how groups become differentiated over time. And as Mehrgol mentioned, psychology can provide a unique perspective to understanding these disparities. In addition to focusing on more macro level systems, cultural and economic factors, psychology will also consider interpersonal and intrapersonal factors, including stress and coping, attitudes and behaviors, and intergroup interactions. And for this reason, psychology has been referred to as a gateway science because it does bridge those factors. Next, please. Here's a list of some of the particular groups that are at risk for worsened outcomes due to both COVID-19 and the climate emergency. This is not an exhaustive list, but it's some of the groups that I'll be discussing today. And in terms of risk factors for these groups, they appear to be somewhat additive in terms of risk and outcomes. So for example, if you're a refugee, your experience might be worsened still if you're also a woman or girl, and even further if you're of low socioeconomic status. Next, please. The first group that I focus on in particular is that of women and girls. I'll highlight a few areas for each population in which we see these disparities, and also important areas that policy should address in this disaster planning. The first is health and safety. So first, we see increased rates of gender-based violence as a result of both climate change hazards as well as the COVID-19 pandemic when individuals are in close and shared living spaces. In addition, we see lowered rates of reporting. So the cases that we do hear about are just a small fraction of what is actually occurring. And this fuels an invisible pandemic of violence towards women and girls. This population also has reduced access to sexual and reproductive health services. This is one of the first things to be deprioritized when these crises take over. In terms of labor and care work, we know that women tend to do a disproportionate amount of care work for elders and children. And this second shift is heightened in terms of emergency. In addition, women may be responsible for educating their children, for example, during the pandemic, in which a large amount of children have pivoted to remote or online learning or are out of school completely. Women are typically responsible for the mental and physical health of their family and provide forms of both visible and invisible support. And finally, we know that women are essential workers at the front lines of both the pandemic and climate change. So as resources become scarcer due to climate change, women and girls must walk further, wait in line longer to collect food, water, or firework, therefore increasing their labor burden. In the US in particular, Black and Hispanic workers are disproportionately represented as essential workers during the pandemic. I want to quickly speak about sort of a case study in the United States with the intersection of gender and race. We know here that during the pandemic, Black and Latinx women are disproportionately represented in hard-hit industries, putting them at risk for food and housing insecurity. And we also know this is problematic because women's economic recovery has been shown to be slower compared to men's after disaster. But this highlights a racial justice paradox in the United States, where Black and Latinos are more likely to be unemployed due to the impacts of the pandemic, but they're also overrepresented among the essential workers that have to stay in their jobs and are at greater exposure to the virus. Next, please. For children, the main issues of concern are health, safety, and poverty, as well as quality education and the learning crisis. So first, children experience reduced access to healthcare services and especially immunization as a result of the pandemic. There's increased child and family violence, which potentially perpetuates the cycle of intergenerational violence. We know that certain things like lack of nutrition, environmental stimulation, security, or prolonged stress during critical periods of development can have detrimental long-term consequences, for example, for neurological development, which can impact children's schooling down the line. Economic hardship faced by families may result in additional child deaths and infant mortality in the thousands. And one understudied area is the psychosocial impact of caregiver loss and grief in children as they lose caregivers to these two global events. Finally, we know the importance of formal education for reducing poverty and fostering economic development. But in April of this year, billions of children were out of school and many lost access to school, free and reduced lunches. So this is another important point, as well as children that are displaced due to climate events. So policy solutions should be focused on equity of access in education and health services, but also focus on the most vulnerable children. So those who are poor, those who might be in detention centers, migrants and refugees, and so on. Next, please. For migrants and refugees, the similar areas of concern are health, safety, and poverty. So with this group, this population is faced with income losses, difficulty meeting basic needs, food insecurity, and limited mobility due to border closures. We also know living conditions are not ideal and lack proper sanitation. In addition, there's many barriers to receiving and seeking out and receiving healthcare, including lack of funds, discrimination, not knowing where to go, and cultural linguistic barriers. In addition, this group faces racism and xenophobia, so there's been increased prejudice and discrimination during COVID-19 towards these groups. And as a result, this has exacerbated stress and worsened health outcomes for these folks. One interesting area and unique area of need here is a need to have some sort of international acknowledgement of forced climate migration. Some have coined the term environmental refugees to describe folks that have been forced to leave their habitat, either temporarily or permanently, due to some sort of environmental disruption. But this has yet to gain complete international acknowledgement and to be solidified in those laws. Next, please. So I'll leave you with some broad policy recommendations. The first is to acknowledge and increase awareness of group disparities. So this might include just first collecting the data on these folks and then focusing our efforts around the most vulnerable populations among those groups. Second, we need to include special considerations for vulnerable populations in policy. So policy including emergency preparedness and response plans. So for example, we might want to include a plan for gender-based violence in disaster planning, or something for the care economy during disaster planning for women. And finally, we need to increase representation and participation of members of vulnerable groups. We need to include vulnerable groups in economic planning and emergency response, and we need to support organizations that are often on the front lines of response in these communities. Thank you.
Thank you so much, Maya, for that very interesting discussion. So now we're going to move from speaking about specific groups to talking about the relationships between and within those groups. And this section will be led by Dr. David Livert.
Good morning. So far, we've introduced to you a vocabulary, an ecological vocabulary in psychology, moving from the group level to the intrapsychic level. And this may be new for some of you, maybe not. Today, I'd like to talk about the interpersonal level. That is how we see COVID and the climate change challenge impacting social relations. And a lot of the material that I'm going to talk about is drawn from a subdiscipline of psychology known as social psychology, and harkens back to some of the founders in that area, Kurt Lewin and Brunswick and others. What I'm going to do is to share with you some recommendations and then go into a little greater level of detail regarding each of these. So there'll be 5 relationships in close dealing with the ways that people relate to one another. Next, please. Social isolation, forced proximity, forced displacement, all of these situations strain existing close relationships, families, friends, and so on. Next, please. To cope with these, evidence suggests several strategies. One, within a relationship, for those in the relationship to adjust their expectations regarding how things are going, and to face the fact that, yeah, we're in a crisis situation and things will be a little more stressful. Secondly, we need to be careful about the way we talk about social distancing policies. Keep in mind, social distancing policies have to do with physical location, not with social connections. And as much, we all have advice regarding face wearing and standing 6 feet away from one another. But with those, we should also complement those with tips on how to stay in touch. Thus, technologies that reduce social isolation play a key role. However, digital communications is not everything, and we should find ways to better use it to maintain connections between people. Also, we have to keep in mind that all of the people that we've talked about who face challenges often have children or adults that they're taking care of, and social isolation may challenge them as well. Now, all of the recommendations I'm talking about today are drawn from good evidence, and I don't want to take time to go through each detailed bit of evidence for them. But we do know from scientific evidence that the loss of residence is a key stressor. And we also recognize that over time, climate and COVID can impact our access to where we wish to live. We know that isolation and strain can create mental health issues or exacerbate those that already exist. We know that forced proximity may often create a risk factor for aggression. And we know that as providing the key source of support for children, parents who are stressed face even greater strains. On to cooperation, please. Great. Another recommendation is to increase the cooperation and interactions between members of dissimilar groups, particularly those groups that may be at odds. Next. Seek opportunities for increased intergroup contact. And when psychologists say this, this means the idea of getting people from different groups together in optimal situations. It has been found, intergroup contact has been found to ameliorate intergroup animosity, to reduce prejudice and discrimination. Also, one key recommendation we have is to broaden moral communities. Our moral community, whether it's a faith community or another form of community, shares our morals and our social norms. And one of the challenges in one direction to go is to try to increase these communities to encompass more, either from the top down, social policy, or from the bottom up, grassroots efforts. Next, please. Where possible, increase the coalition between groups traditionally in opposition, such as faith communities in the states, political parties, as well as citizens and policymakers and scientists who really may be in opposition with regard to climate change or COVID. Also, we are interested in creating new group identities that are more encompassing. Recognize that groups face common risks in both situations, in both crises, and that common risk may be a way to leverage a greater common identity. On to social networks, please. Broadening social networks is another important recommendation we have. Next, please. Social networks are the people we are connected to outside of our family, and well, can include friends, but we think about a social network as everyone we can communicate to. Who do we pick up the phone and talk to when we have a problem or when we want to share good news? It's very important to seek ways to expand and to strengthen these social networks as people face displacement and other challenges. One of the key areas is boundary spanners. People who are members of two social networks can often play a really important role in bridging them. Onto social norms, please. The family of interventions known as social norm interventions are rather specific, but they have shown over the last 25 years to improve pro-social or pro-environmental behaviors and reduce others. Social norm intervention is essentially letting people know what other people really do. Often we live in a state of pluralistic ignorance in which we think everyone does something, but in fact we're absolutely wrong about it. Next slide, please. These social norm interventions are very effective when they target a social network. They are also more effective when the behavior that we are interested in changing is observable. And in fact, when the social norm communications is salient, when someone's about to enact a behavior. Next, please. Just like around our dinner table, we are more likely to commit to something and carry it out if we make it publicly. Thus, to our commitment to sustainable or public health behaviors are stronger if we make them in public. And on to building communities. Finally, our last recommendation has to do with the building and maintaining of the connection between people and place. Next. We've talked about social embeddedness, but part of our social embeddedness is physical. Our social systems are linked to particular place, and therefore the disruption of our connection to place can have negative impacts. We encourage the initiation of informal community events within the constraints of if necessary, social distancing. And also to elevate keeping people at home or people near home in interventions both for climate and for COVID. Moreover, we know that some spaces are better than others, that public spaces that encourage interaction while maintaining social distance, for example, during a pandemic, can play a very important role in keeping that connection to community. So all of these recommendations, if you want to look at further evidence, you can ask us for a copy of the presentation or other documents that we have. Thank you very much.
Awesome. Thank you so much, Dr. Livert. And now I would like to invite Priyadharshany Sandanapitchai to speak with us about mental health.
Thank you, Mehrgol. Hello, everyone. It's nice to meet you all virtually today. I'll be focusing on the mental health aspect. I'll be answering the three main questions. That is, next slide, please. What is mental health? Why is it an important aspect to focus? And how we address the mental health needs? So we are beginning with the definition of mental health. So according to WHO, mental health is defined as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her own community. So this literally breaks the myth of relating mental health to just the mental health disorders. Rather, it's our overall emotional, psychological, and social well-being that controls our ability to navigate through hard times and to function optimally. Next slide, please. Studies show that COVID-19 shares similar psychological impact on individuals who have experienced the pervasive effects of climate change. Here you see a simple diagram that shows some of the stresses of COVID-19 and climate change and its psychological impact. Under COVID-19, you see change in normalcy, being physically ill, loss of loved one, unemployment, feelings of uncertainty, lack of social interaction have significantly increased chronic as well as acute psychological conditions like stress, anxiety, depression, PTSD, substance use, and suicidal ideation. On the other hand, you see climate change, events like natural disasters, extreme weather events, increasing temperature, rising sea level, displacement, and fear about the future have similar psychological impact to that of COVID-19. Next slide, please. So despite the significance of a positive mental health in improving the overall well-being and the quality of life, it has continually been a less prioritized and overlooked topic of concerns. Lence's 2016 report on sustainable development and mental health defines mental health as the most neglected of all human health conditions and a failure of humanity. So how do we really address the mental health need? Next slide, please. So we are proposing two major recommendations on mental health approach on how to really address this mental health needs and the lack of knowledge. The first being the importance of mental well-being and destigmatizing mental health care, and the second one is evidence and tailored-based. So I'll be try to briefly explain each recommendation with an example. Next slide, please. So the first recommendation is mental health well-being. So we are living in the middle of a pandemic, feeling sad, anxious, angry when we faced with adverse events are quite normal. As human beings, we all go through these emotions. However, it becomes a concern if those symptoms continue for a longer period of time, disrupting our daily functioning. That's when you need to intervene with the professional help. But the stigma associated with the mental health, specifically cultural stigma, even expressing our concerns about mental health to open up becomes difficult to seek professional help. Next slide, please. Therefore, it's important for us to destigmatize mental health care and provide culturally appropriate services. So I'm just going to carry over the last point using an example in the next slide. Next slide, please. So here you see Minnesota's Department of Health. Minnesota's climate is changing with serious consequences of human health. So Minnesota's Department of Health came up with climate and health strategic plan to prepare and respond to climate change and its impact on public health. One of their goal is to develop research projects is to describe mental or emotional impacts related to climate change that mental health providers are seeing in patients. So it's a great step of acknowledging the mental well-being in public health policies relating to climate change and allocating funding and resources and expanding strategies to address individual mental health needs impacted by ongoing climate crisis. Then we are moving on to our second recommendation, which is providing tailored and evidence-based mental health support. COVID-19 has presented a serious global threat to the healthcare system, and there's increasing demand of psychological services in digital platforms especially. But the problem with the mental health is that they are not equipped with resources or have sufficient training on how such global events like the pandemic or climate change affects mental health. So as my presentation, it disproportionately affects in groups like children or migrants due to the lack of resources. Therefore, it's important to provide all-inclusive mental health care, especially in emergency, high-risk, and low-resource settings. Next slide, please. So from a policy perspective, one of the biggest obstacles in implementing such practices is that it's viewed as expensive, or mainly due to the lack of foresight. Why? It's because having a high upfront cost for prevention strategies is much better than spending so much on treating psychological problems for an extended period of time. And such investment at the beginning can also have long-term positive return. On the side, you see one of the most commonly used evidence-based intervention, which is a psychological first aid that focuses on reducing the acute distress caused by traumatic events like natural disasters and provide coping strategies, and they also make referrals. So what now? We have seen that it's clear that COVID-19 and climate change has caused detrimental impact on mental health directly and indirectly. Protection and promotion of mental well-being should be prioritized at multi-levels from the individual, interpersonal, organizational, community, and policy to have a holistic approach. As we saw in both recommendations, the input of mental health professionals is crucial. Therefore, they should be included in such conversations and should be essential in response to COVID-19, included in COVID-19 and climate emergency. The more we avoid addressing the mental health issues, we are also in the global mental health crisis dramatically. Policymakers should focus on the burden of the health, but also identify the social, economic, environmental factors that promote mental well-being. Thank you so much.
Thank you very much, Priya, for that very important information. Before we move on to the next presentation, I just want to say that I see some really great questions coming in, and so I encourage all of you to feel free to post your questions and we'll talk about them during the discussion. So now I would like to invite Dr. Laurel Peterson to speak a little bit more about cognition.
Okay, thank you so much for that introduction, Mehrgol. Can everybody hear me okay? Okay, great. So moving from the society to the individual, this part of the presentation is going to explore a little bit more about the mind. So a really important central area of inquiry in psychology has to do with cognition. And we're here to argue that cognition is really, really important. So cognition includes the mind and patterns of thinking, such as decision-making, attention, memory, mental shortcuts, language, etc. And there's two challenges to cognition for both COVID-19 and climate change that are really important here. The first is psychological distance. So events that are more cognitively distant from an individual are often much more difficult to comprehend. So for example, coronavirus is a major threat and it does seem pretty scary, but it's probably not going to happen to me. It's probably not going to come to where I live or happen around where I live. So that's one example. And then another is the present bias. So current events like COVID-19 may be more important in one's immediate cognitions than risks that will happen in the future, such as maybe negative outcomes of climate change. Cognitions such as risk perceptions can be very difficult for public health messaging to change, and changing risk cognitions doesn't always translate to behavior change. So we have a little bit of a challenge here. Next slide, please. And a major recommendation that we have is using social cognitions to influence behavior. So we're going to go over two of those. The first is utilizing personal narratives, and the second is promoting positive prototypes. Next slide, please. So our first recommendation is to promote personal narratives, specifically use stories of socially similar others regarding risks. So using stories to promote public concern about climate change versus facts can be more effective in motivating prevention behavior. We're going to zoom in on one particular research study that showed some of these effects. So these participants were all recruited from upstate New York, so rural New York State in the United States. And instead of having the messages about climate change focus on facts about climate change, such as increased temperature shifts, glacier melt, things along those lines, it honed in on the anticipated increased risk to farmers, which are a member of upstate New York community, and specifically the increased risk to farmers for mosquito-borne illness. So as the temperature becomes warmer, there's threats of greater mosquito-borne illness, such as West Nile virus. That's anticipated to spread north up the globe. So this study found that when this personal narrative approach was focused on, that related to greater support for climate change mitigation policy in the US, and that this had the highest impact when that particular story was centered on a farmer living in New York rather than a farmer living in a different state or a farmer in an international context. So these results really show that narratives can be particularly compelling in closing that psychological distance and result in greater support if the respondent feels more proximal and socially similar to the potential victim. Next slide, please. Our next recommendation is to focus on enhancing positive prototypes. Prototypes are a cognition that completely skirt cognitions surrounding personal risk perceptions and go straight to the behavior. So prototypes are images of the typical person who engages in a behavior. So everybody has a different prototype for different behaviors. So if you think of the typical mask wearer, some people may think that that person is really responsible. Some people may think that that person is really paranoid. And there's these individualized perceptions that are positive or negative of particular images. Meta-analyses for other health issues have demonstrated that prototypes are really powerful drivers of behavior change across various health domains. And additionally, prototypes are most influential when behaviors are new and individuals have less experience with them. And a lot of behaviors to prevent coronavirus and climate change are very new for people. Next slide, please. So some initial research in a nationally representative sample of individuals in the United States does show the potential power of prototypes, such that more positive prototypes of a hand washer, mask wearer, a person who engages in cleaning and sanitation and physical distancing, that related to greater intentions to engage in those protective behavior and subsequent increases in those prevention behaviors 2 weeks later. So this is some evidence suggesting prototypes can be effective. Next slide, please. So So sort of putting it all together, how could prototypes potentially be used in policy initiatives? The Mask Up Philadelphia campaign is one example that was on a local city level in Philadelphia, Pennsylvania, and combines positive prototypes, moral norms, which my colleague David touched on a little bit, and language representation, which my colleague Maya touched on a little bit. Next slide. So Mask Up Philly is a health messaging campaign. You see some examples of the campaign on the slide. So as you can see in these examples, that focused on real Philadelphians donning their masks and projecting a positive image of these individuals, someone engaging in the behavior who's helping their community. The messages were posted in public outdoor places, such as on buses and billboards, etc. And as you can see here, the message doesn't focus on the risks of COVID-19 or trying to argue for mask effectiveness. It solely focuses on positive representations of the individual engaging in the behavior. Next slide, please. The campaign also incorporated language representation and recognition of Philadelphia's language diversity. Next slide, please. And additionally, the Mask Up Philly campaign cooperated with the arts program, the Philadelphia Mural Arts Program, to update many of the city's most famous community murals so that the local heroes in those communities would also be donning their masks. Next slide, please. So initial data from the Department of Health in Philadelphia does provide some insight on the efficacy of the campaign. The campaign was introduced in July with widespread saturation, and by the end of August, Philly was making national news as one of the locales in the United States with the highest adherence to mask wearing, including over 95% of people wearing masks in stores, and huge increases in gains in mask wearing on the sidewalks. And part of this is attributed to the fact that a lot of the campaign had the messaging in outdoor public spaces. So combined, this shows a potential avenue for the beneficial use of enhancing positive prototypes to change prevention behavior. Thank you.
Great. Thank you so much, Dr. Peterson. And now I'd like to introduce our final panelist, Dr. Colón Rivera, to speak a little bit about his perspective from the policy world.
I'd like to thank the Society for Psychological Studies, Social Issues, and the CUNY Committee for organizing this panel, and our panelists for these engaging presentations on such a timely topic. I would also like to make a quick disclaimer right now because of the nature of my work. This discussion is based on my opinions, based on the work that I do. It doesn't necessarily reflect the opinions or views of the office that I work for. So when we talk about public policy at its very core, we're talking about regulating people's behavior, setting ground rules on how humans comport towards each other, towards their environment, etc. However, changing behavior, as was mentioned earlier, requires understanding of how people make sense of their world. So when we talk about changing behaviors when it comes to environmental policy or COVID-19, we need to make some observations about Americans' beliefs on both of these issues. And I will also apologize because most of the viewpoints on this presentation will come from the American political standpoint, just because it's the nature of where I work and my expertise. So the survey of nearly 11,000 American adults in the U.S. conducted earlier this year by the Pew Research Center found that most Americans, 63%, believe that climate change was real and that it was affecting their local community. Additionally, 65% of Americans believe that the federal government wasn't doing enough to combat the effects of climate change. However, that study also found an ideological gap between those beliefs. So 72% of people who affiliated themselves with the Democratic Party versus 22% of people who affiliated themselves with the Republican Party said that human activity is actually contributing a great deal to climate change. Equally, 83% of people who identified with the Democratic Party said that climate change is affecting their own local community. Can y'all hear me? Okay. Okay. So 83% of people who affiliated with the Democratic Party believe that climate change was affecting their local community versus 37% of Republicans. So there's a 50-point gap in that ideological gap between people's beliefs of how they identify within the liberal conservative spectrum, right? Similarly, when examining the role of political ideology plays on Americans' beliefs about the COVID-19 virus, recent sociological research, social psychological research has found that, and I quote, conservatism was associated with perceiving less personal vulnerability, rating the virus as less severe, and agreeing more that COVID-19 was the result of a conspiracy and that the media had exaggerated the risks of the virus. So, as someone like me who works in the realm of policy making, understanding that ideological gap is really important. And I believe that this is where psychology has its greatest role to play. Because in a country that's so sharply divided along ideological lines, changing behavior in order to bring positive policy change will take every tool in the psychological science box in order to bridge that gap. And this is especially important nowadays, as we find that more and more people, as they have to stay at home, are getting their news from social media sources. And from what we know from social media, these platforms do whatever they can to keep your attention on their platforms. So if you interact with digital content that might have a specific political skew and have specific information, whether it be news sources, reputable or not, memes or influencer pages, the platform will continue to populate your feed based on what it believes, what the algorithm believes are your preferences. So you essentially keep getting your information reaffirmed in the same bubble. And so that, essentially is contributing to, many Americans living in parallel universes when it comes to an ideological gap. So how do psychologists bridge that gap in order to find some commonplace to serve as a springboard for sound psychological and sound social policy? And it's clearly not badgering each other with our own facts. So some of the previous presentations provided great examples. So seeking opportunities to increase intergroup contact and group collaboration, facilitating coalitions and interactions between groups that traditionally oppose each other, encouraging mutual assistance coalition agreements and plans for public health emergencies, as well as using social cognitions to influence behavior such as personal narratives and promoting positive prototypes. These tools that psychologists have in their box can be used to bridge the gap between competing constituencies. And in the end, the way policy at the systemic level gets done is primarily pushed by the consensus of constituencies, because ultimately, if you are an elected official and you don't represent your constituency, you will get elected out. And we've seen how some of these strategies have worked in Congress in the past, especially with issues that are political lightning rods like immigration, where we've brought together members of the opposing parties, and we've to discuss a particular issue, and each members from each party have had their own their own set of stakeholders, their own specific constituencies, and their own political ideologies, but they've sat down to look for compromise in terms of advancing a political position. So we do know that some of these strategies do work at the policy level. It just takes political will to want to make that leap in order to get the policy done. And so, psychology can be used to produce evidence-based research to help break down these ideological barriers between opposing constituencies on specific policy matters, and move those models, hopefully out of journals and into the policy rooms where policymakers are making these decisions. Because if we don't find common ground on how to tackle climate change and the COVID-19 pandemic, those who will suffer, as was mentioned earlier, are most vulnerable populations. So I'll end my presentation there. I'm not entirely sure if everybody got it. I see that I'm kind of bouncing around, but thank you.
Thank you so much, Dr. Colón Rivera. Your insight was really valuable, and we really appreciate you being on the panel. I'd just like to take a moment to thank all of our panelists so much for their wisdom and their insight. I'd also like to thank the conference and the technical staff in particular, who really were pivotal in bringing everything together that you saw today. So now, before we jump into the discussion, if we could just get this final slide up, please. I would like to present to you some key takeaways from all of the panelists' discussion today that relate to COVID climate change from a psychological perspective. So first, I don't think this is going to come to as a surprise to most of you, but the first key takeaway that we suggest is listen to the scientists. As we all know, the COVID pandemic has underscored the importance of trust and merit in science. We contend that this also goes for the social and behavioral sciences, and we actually have a really great question in the discussion that will speak to the more specific role of the social sciences. We believe that psychology can provide unique insight on human behavior and potential interventions to promote targeted behavior as it relates to mask wearing and other public health preventative measures during the COVID-19 pandemic, and the same goes for climate change and the adoption of climate change mitigating behaviors. And then the second key takeaway that touches on the different presentations you heard today is to think globally and act locally, the common adage. So both COVID-19 and climate change are global crises that impact every individual on the surface of the earth. We can leverage that to form broader common identities with people and forge new collaborations. And this requires us to consider the many ways in which we are interdependent on one another, for our sense of well-being, feeling of belonging, and for the sake of our mental health. And we must be flexibly adaptive in the ways we connect with one another. But on the other hand, we must identify the specific needs the specific needs and strengths of local communities, including communities that have a heightened vulnerability to these crises. Community initiatives for behavioral interventions and mental health can be highly effective, as you heard a couple examples today, in combating stress in the face of these global crises. And third, we contend that any approach needs to centralize a human rights-based approach. And so we started this panel by speaking about the history of psychological advocacy for human rights. And what is clear is that both of these global crises pose threats to human rights around the globe. They expose underlying group vulnerabilities that are the product of historical disenfranchisement through various systems of oppression. And we must prioritize human rights when considering, for example, the circulation of a forthcoming COVID-19 vaccine, as well as updates to our laws that support environmental refugees and other displaced people as a result of global rises in temperature. So for all these reasons taken together, many of us on this panel contend that individuals, communities, policymakers, nations, civil societies, and all stakeholders should consider the intersection of both global crises, how they relate to one another, and how we can draw parallels between them in order to paint a more holistic view of each issue and the ways in which they can be remedied. And we offer evidence from psychological science as one component of this undertaking. So now, without further ado, let's jump right into the discussion. You can still submit your questions. And I'd like to again remind you, if you're interested in hearing more about this report, feel free to reach out or drop your email in the Q&A as well. So I will start with a question that came in through the Q&A. So I pose this to all of the panelists, but in particular, I would just like to draw the attention of Dr. Walker, Dr. Peterson, Dr. Colón Rivera, and Ms. Sandanapitchai, but everyone is welcome to answer. So the question is, one of the critiques of approaches that focus on behavior change is that too much onus is placed on individuals. Rather, attention ought to be placed on systems and structure. So for example, how cities are designed, incentives provided to people, such as making land more expensive in suburbs to reflect the real cost of building infrastructure, etc. What do you think? How can your work on groups and individuals inform these ideas?
Well,
So feel free to
as a next urban planner, I would suggest that psychologists are very willing to work cross-disciplinarily, and that is a step that can be taken in the design of cities. I think that would be one way of addressing the question. Anyone else?
That's excellent. Thank you. Laurel, maybe do you want to add something?
Yeah, sure. I think I just thank the participant who brought up the question, because I think this is a really, really crucial area. Because part of the issue definitely has to do with barriers, right? So if we're thinking of particular individualized behaviors, trying to make shifts in individualized behaviors, you know, it's going to be hugely challenging for folks to don and wear masks if there isn't access to tools to use masks. It's going to be really challenging for individuals to engage in, just thinking of some of Pete's examples or thoughts, you know, biking to work if a city is not designed to be bike friendly. So there definitely has to be cooperation between structural barriers and reducing structural barriers, as well as focusing on individualized cognitions. But they have to work in tandem, because we know from research on health behavior change and other sorts of change, even sometimes when individuals have access and knowledge to engage in prevention behaviors, there are still gaps to enacting those behaviors. So I think it really takes cooperation across levels.
That's really great. Thank you. Dr. Colón Rivera, I wonder, in your role as an advisor to policymakers, how do you see, how do you balance this tension between individual level behavior and kind of top-down influences and systemic control?
Can you repeat the question?
Yes, sorry. So I was just wondering, in your role as an advisor to someone who is in a position who can make kind of top-down policy level decisions, how do you see this balance of individual level behavior change versus systemic shifts in structure and system that would then promote that behavior change?
So when it comes to policy decision making, as I mentioned before in my presentation, a lot of it comes down to your constituency. Can people hear me okay? It comes down to your constituencies. And so independently of, you know, your political ideology or what your beliefs on a specific issue is, whether it be, you know, environmental change or COVID-19 or how we deal with the COVID-19 pandemic, working with constituencies on how they, you know, so for example, I know many members of Congress who themselves believe in climate change and that there's something that needs to be done about it, right? But in a politically charged atmosphere where, you know, buzzwords like Green New Deal can kill your political career, you'll have those same members kind of deny the science behind you know, climate change, and will deny moving forward any legislation that can, you know, combat the you know, systemic what's happening on, you know, what's happening with the climate and our role as the United States in that process. So changing individual behaviors and changing individual beliefs at the grassroots level to find that common ground will ultimately lead, in my opinion, to enough goodwill to move, you know, policy decision makers to make the correct decisions based on the science and based on, you know, what's in the best interest of society and the world in general.
Dr. Peterson pointed out that the storytelling is important, and in the work of psychologists with city planners, the way you structure it and finding the co-benefits of the policy would strengthen your argument and improve the city response to both COVID and climate change.
That's great. Thank you so much. I wonder, Priya, do you want to add something about your example from the Minnesota Department of Health, how kind of that top-down system promoted greater attendance of mental health care?
Hello, can you hear me?
Mm-hmm.
Yeah. So I think it's very important to kind of like reinforce those behaviors from a policy perspective. And one of the other recommendations that we had was about like how a community can come together in terms of fighting against certain myths about climate change or even the COVID-19 pandemic. And there are a lot of like root organizations that started to kind of bring more awareness, education, and also have done a lot of policy work in terms of bringing people who are not really engaged in this kind of conversation on a regular basis. So there are a lot of myths with some individuals. So this kind of policy that brings out awareness and allocate funding and resources for us to kind of like spread out the word, what is the science behind it, that really helps to break out certain myths and will reinforce certain like, you know, pro behaviors in individuals, especially with related to healthcare or even like any strategies that we are trying to, you know, come up with in COVID-19 or in climate change.
Yeah, absolutely. I think what you raised the very important point of resources and funding allocation, which we haven't spoken much about, but that is absolutely critical in supporting these initiatives. So Dr. Livert, Ms. Godbole, I'd like to invite you to answer this question if you have additional insight. Otherwise, we can move on to the next question if you'd like.
Why don't we move on?
Sounds great. So we have two questions from the audience that I think will go nicely together. And in particular, I'd like to direct these questions to Dr. Livert and Dr. Peterson. But again, all panelists are welcome to add in their insight. So the first question is, do you have any recommendations on how to have conversations with our relationships, so our family, our romantic partners at work, on adjusting our expectations of those relationships during challenging times? And then the second question is, with such ideological divides, how does the panel suggest tailoring positive prototypes to meet both sections of the community concurrently? So kind of balancing discussions with people who are similar to you and people who are different from you.
David, do you want to take the first and I'll take the second?
Yeah, yes, and let me make one point about the second, and I would ask Angel this at some point too. You know, is there a new role for translating science, not just into public policy, but in helping those elected officials who may face the conundrum of not being able to use certain words, but do subscribe to, you know, scientific beliefs? I'm wondering if there's a space there for greater work in terms of scientists helping those elected officials who in spirit are believe the science, but are restricted in a lot of ways. That's just an open question. With regard to adjusting expectations in close relationships, I don't know if I have any specific recommendations, and I'm not a marital or relationship therapist, but the idea is both for people to understand that there is a different situation, that, you know, with social isolation or with displacement due to climate change, whether it's temporary or permanent, this is a tremendous stressor. That is a chronic stressor as well. So there's the idea of understanding that for yourself, and then for the others that you're in relationship with. So in other words, cutting a little more slack, or being able to find ways to have that moment of reflection before we respond to something. Those are a couple of strategies I would suggest, at least. And the expectations being something that we internalize, because we also expect, and we've already seen the impact of the forced proximity and social isolation of COVID on children. We've already seen it on domestic violence. We know it's out there, and we need to very, very clearly acknowledge it. So that's my thought on that subject.
Mehrgol, would you mind briefly repeating the second question?
Sure, no problem. So they ask, with such ideological divides, how does the panel suggest tailoring positive prototypes to meet both sections of the community concurrently?
Thank you so much for this question. And I think it's a really exciting question, because all of the research that's been conducted on prototypes, there's mountains of research that have shown, has demonstrated the immense efficacy of prototypes, and it's just now starting to break out into intervention-based studies. So it is a really exciting time. Simultaneously, it's emerging. So there is not extensive research on the use of prototypes in interventions. But what's exciting about prototypes is that prototypes are highly malleable, and they're also very individualized. So prototypes influence cognitions across all sorts of groups, across all sorts of people, because prototypes are highly socially and culturally reflexive. So they're individualized. So an important aspect about messaging with prototypes kind of harkens back to some of the other topics that my colleagues were bringing up in the presentation, and that is that it's important for the prototype to be socially relevant for the message recipient. So individuals construct their prototypes both via their community, public health messaging, media, things along those lines. So it is a really exciting time, and prototypes really have the possibility to enhance behavior change, and I think it's a really promising area for future work.
Thank you. That's very interesting. I wanted to give Dr. Colón Rivera an opportunity to respond to Dr. Livert's open question from a little bit earlier. Maybe, David, if you want to just restate bits of your question.
Oh, the question is, in terms of supporting elected officials who may, for political reasons and constituency concerns, not be able to voice a new Green Deal or that type of vocabulary. Is there a place, though, for scientists who are working to translate science into policy to help develop a vocabulary that they can use?
Absolutely, there is, and what I would say, the place is not academic journals. The place is probably on campaigns. Anybody who's worked on campaigns can tell you that this is the moment that the elected official is going to be out there the most, working with his or her constituencies, communicating directly with them, and kind of it's essentially they're at their most vulnerable at that moment, because whatever their constituencies believes with them, that's what they will confront them with. But if they have the tools to message correctly, most people, for the most part, believe that their elected officials are good people, right? Why? Because they elected them, right? It's part of their own choice to put them in the place of power. But also, when you're an elected official, you have the opportunities to help people individually, disregarding what your political values or beliefs are. You can help people, kind of navigate, the federal government. And so in that sense, people are attuned to listen to what they consider as as thought leaders, or as elected leaders. The question is, the issue is allowing them the tools to message correctly. And we all know that most politicians are kind of amateur psychologists when it comes to telling stories, anyways. So that's the most engaging way to kind of change hearts and minds when it comes to engaging your constituencies. But putting that with it, in a more getting method to that is a completely different consideration than just going out there and telling your heartfelt stories in an effort to change a mind.
Thank you. That was very well said. I'd like to ask a question to a couple of our panelists before ending with one final question for the entire panel. So this question is directed to Dr. Peterson, Ms. Sandanapitchai, and Ms. Godbole. So I was wondering if you could speak a little bit to the importance of culturally sensitive or culturally appropriate mental health care, public health messaging, and behavioral interventions. I know that's something that's very important, especially with both climate change and COVID affecting everybody on the planet. We can't all, I'm sure, have exactly the same intervention plans or policies, etc. So could you speak to this, and could you speak a little bit about how psychologists from different subdisciplines can collaborate to achieve these goals? And again, I invite you three in particular to answer if you'd like, but the question is open to the entire panel.
Well, with regard to the culturally appropriate services, because culture has an important influence in one's belief system, I would say, like their values and norms. So when we think about the mental health care system, culture kind of like has a range of implications on how one views about mental health or illness, or whether they are seeking treatment, or whether, like, how they are seeking treatment, to who they are seeking treatment, as well as like what kind of coping strategies that they have depending on where they are coming from. Because when you think about very collectivistic culture, they kind of go towards family and like family support system or the social support system, whereas in individualistic culture, it's more of like you are kind of looking after yourself and maybe more likely to go to a professional help. So therefore, it's very important as a mental health professional, we should have an understanding of where that person is coming from, especially their cultural background. That gives us an idea of what are the major strengths and weakness of that person. So it's easy for us to kind of modify what kind of treatment that we give them, or even what kind of message that we can give to kind of raise awareness about the mental health with regarding to COVID-19 climate change, and it helps us to modify such a treatment. So I think it's very crucial for us to kind of understand those cultural differences in terms of how we do the messaging, and it's important to kind of bring this onto the table when we address any mental health needs.
In terms of public health messaging, I think this is a really, really important area, and it can completely make or break the efficacy of public health messaging to diverse cultural groups. So it's really important that public health messaging is culturally relevant and culturally sensitive. And I really want to point out what this does not mean. This does not mean that, for example, a city public health messaging campaign sort of tokenizes an individual in the public health messaging campaign by grabbing an image off Google Images and just making a public health messaging campaign slightly more diverse. That actually can backfire because it can lead to increased unearned trust between public health or city government officials and cultural groups that have typically been left out of conversations. So it's really important that public health messaging campaigns are culturally sensitive, and a lot of this has to do with representation, building partnerships, and uplifting particular initiatives that have already been undertaken by a particular cultural group in a diverse area. So one thing I think that really stands out about the Mask Up Philly campaign, one example of this is the Mask Up Philly campaign's partnership with the city arts program, the Mural Arts Program. So Philadelphia has more public murals per square mile than any locale in the United States. And these murals are developed in particular local city communities. So a lot of the murals are really hyper localized and depict individuals who live in those neighborhoods. They're developed completely by the community. So I thought it was a really elegant example how this already extremely culturally relevant public art installation was then integrated into the Mask Up Philly campaign, and additionally commissioned local Philadelphia artists from those communities when the arts funding was being cut in Philadelphia to uplift the public health funding, that there could even be that opportunity for jobs for artists at the time. So I think that's an example. It's one small example, but it's an example of a way to really have a meaningful representation of cultural diversity and not tokenizing representation of cultural diversity.
Yeah, and I'll just quickly add on to that. I think what Laurel said is really important, is just having these folks represented in the conversation, seeing them represented, seeing themselves represented in data that's put out there, for example, but not doing it in a tokenized way. And I also just want to bring attention to the language that we use in messaging and in reports. Language matters. We really need to interrogate the dominant narratives we use. Who is the default person? Who is the minority group in language? And for example, it can be simply shifting the framing of language. So instead of saying an underrepresented minority, we can say a historically excluded minority. And that way we sort of shift the burden and shift that conversation with our language.
Thank you. That's very important. So now I'd just like to end with one final question. I see we only have a few minutes left. So I want to pose to those of you who conduct research, what do you wish policymakers knew about psychological and behavioral science research? And to those of you who work in policy, what do you wish researchers knew about policy and real world issues? So Dr. Colón Rivera, if I could invite you to speak first, and then I'm happy to have all the other panelists jump in with their thoughts.
Yeah, so, you know, there's an old saying in politics that you're entitled to your own opinion, you're not entitled to your own facts. Fortunately, in the world of science, it is the world of facts. You're essentially interrogating the world that surrounds you, and you're extrapolating information from that world in order to make sense of it. But just because you found an answer to a puzzling question doesn't mean that that answer is going to be followed or paid attention to by everybody. So understanding that there's nuance and within the political world, and that there always needs to be compromise. And even if we have perfect solutions, in the end, what the outcome of those solutions will not be as perfect as the answers that science can provide. So ultimately, policy becomes compromise, even if it is guided by sound science, empirical science. The other thing that I would like to, posit to psychologists is, and I've said this a couple of times in the presentation, is that I've been a strong believer in psychologists getting out of the academic bubble and moving their science into the world of policy. And unfortunately, there aren't many organizations out there that are doing that in an effective way. You have the American Psychological Association. Obviously, you have SPSSI, who's doing that. But because of the way our American law is structured, you're a nonprofit organization, you can only do so much amount of time doing quote unquote lobbying or advocating for issues. And so I think, scientists to a certain extent have to do a little more outside of these specific organizations, or at least empower these organizations to be more vocal in getting their science out there into the policy realm. Because honestly, if you think that members of Congress, if you think the president, or you think, secretaries of cabinet members are scrolling through journals looking for the answers to they're not.
Thank you very much.
Could I second that?
Absolutely.
Is there anybody from the research side that wants to add their thoughts in these last few moments? All right, well, we will leave it at that on a very high note. I'd like to remind you on behalf of the conference to fill out a survey that's going to pop up on your screen as soon as this panel ends. And again, thank you so much for your attention. We were all very excited to be here. And please stay in touch if you're interested in this work. And we look forward to continuing this conversation with you in the future. Thanks to all our panelists, and thank you.
Thank you.